Thank you, everybody, for attending. The first thing about uncertainty, at least from our perspective, many times is it's hard to detect when you are uncertain of something, and that is one struggle that we have all the time. Like, you may not notice that something is uncertain because your mind tends to assume things and follow the path. So one draws assumptions from observation, and it's very hard to break that. For instance, you see me in my shirt and you may assume that I'm wearing pants, which I am, but you don't know because you're not saying that. I'm actually wearing sweatpants because I'm home and working this time is much more comfortable. So you tend to have assumptions, and finding when you're uncertain is the first thing that you need to break. So that's the first thing that we always try to do. Make sure that we line edit ourselves, and I mean, when we are editors or reporters, to make sure that we are not drawing assumptions on every step. And COVID has been a very difficult time to do that because there are been so many unknowns and so many things that was very easy to draw assumptions on some cases. So that's one thing that we needed to be completely interested. Apart of that, we have done a lot of things. Many people that have been doing, like for instance, on our trackers, we have been showing 7-day averages because even if you have like very exact numbers, they tend to change depending on reporter. So if you look at the day-to-day reporting of the cases and deaths, you may notice that they fall during the weekends. That's just because some states and counties don't report on the weekends and on holidays. Not that people is not dying or getting sick on the holidays and weekends. So all those type of things, like some are easy to see like that one, but some are more complicated. So let me show some things that we have tried to do while covering COVID. I mean, and the first one is making clear to everyone that there's a lot of uncertainty around COVID. This is one graphic that we did, a series of graphics that we did. I mean, I'm not gonna put you the whole story because this is the most of it, showing the excess deaths during the pandemic. Like we were having a number of infections and a daily number of deaths, but we knew somehow that there were more than that. Like there were people who get infected and they get asymptomatic and they will never report that case, or there were people who died and they were never tested for coronavirus, particularly at the beginning. Right now, that's more solved. So, but observing all the things, you could see that there were many more deaths than we usually have before coronavirus. But at the same time, you could not assume that those were caused by coronavirus because they could be like lateral effects of coronavirus. Like, for instance, people who didn't attend that delayed treatment or diagnosis from some diseases because there was a lockdown, but at the same time, deaths could have gone down a bit because there was the traffic was down. So traffic deaths were going down. So you need to be very careful on drawing those assumptions. So the first thing that we wanted to say is, look, we think there's something here, but we are really uncertain. And for that, text is very important. Like when we work in data visualization, sometimes we underestimate the power of words. It's like, this is not our thing. We focus more on the graphics and everything, but every graphic, every chart, every map, it also has a little bit of text even. And it's very important how we word that text. Notice, for instance, this is the header of our US COVID tracker with the cases and deaths, and there are some key things here that we wanted to do, like include the more than, because we knew that it was like the minimum, but there are possible unreported deaths. We wanted also to round the numbers because even if if we know that this is not an exact number, why give you a very that perception of exactitude that we didn't have? We do the same with political polls, for instance. We can tell you that based on our polls, 56.38 of the people is gonna vote for this candidate, but we really don't know. We know there's uncertainty and there's a margin of error, and that this is just a poll. So we tend to round the numbers in that case. So we wanted to do it here. But yeah, that's the other thing that we wanted to be very careful. Like every time that we talk about infections, we talk about reported infections, and you can see here like cases have been reported. That doesn't mean that those are the cases that have existed, and we wanted to make sure that we conveyed that there were more deaths and more cases than that. The thing that we try to do a bit more different is to try to explain concepts to people instead of certainties. Like we needed to explain this new disease to everybody, but the reality is like we didn't know much about the disease. We could explain things about how these diseases work, how things used to happen, being very careful not to say this is how coronavirus work. So in order to do that, one of the things that we did was created a fake disease to explain this concept. This is a graphic that was very popular that we published in March 14. So that's the week that we went home from the newsroom. Like that's where the beginning of the pandemic, and where there were so many unknowns about the coronavirus. Not that there are not now, but there were even more then. But we wanted to explain that this is going to grow. Like one thing that we know is this is not going to go away so easily. But we didn't know how to explain the details on coronavirus, so we created simulators in this case. And in these simulators, we try to explain the rules of this disease, like everybody who becomes in contact with other will get infected, and nobody dies of this and eventually recover. And once you're recovered, you don't get it again, which is something that we know is not true for coronavirus. So we wanted to be very clear about that. And that way we could explain how these diseases work, like how with everybody moving, we create, I don't need to explain now what is flattening the curve, which was part of the intention of this graphic, because now everybody knows, but we wanted to explain how to flatten the curve and how different systems achieve that without implying that coronavirus work that way. We didn't know then, we don't know yet. And we try to follow that idea through the different stories that we did. And when we explain models and why people were presenting different models, we try to keep the same. Like, imagine that you are an epidemiologist and we have created a fake disease case simulator. So we kind of continue with that because we needed to explain in the general without being able to say anything about the particular of this disease. We wanted people to understand those concepts without conveying the certainty that this is how it's gonna work. It's more like this is how these things usually work. I'm not getting too much into the details of every graphic because if not, it's gonna take me more than 10 minutes. I wanted to show a little bit about this. And when we wanted to explain how herd immunity work, we also tried to needed to be like very detailed on how contagions work and how herd immunity works without getting into those details. So you need to explain things, but you need to convey what you know and what we don't know and be very clear about that. And those details can be, you can use simulations. All these were things that Harriet Stevens, the reporter who worked on this one, discussed with epidemiologists and is well sourced and everything. I'm not meaning that this is all in the an experiment, but gives you a bit of the idea of what we were talking. We carried that thing to other stories and also created like fake cities like Scienceville, which was this fictional town here where the coronavirus, also people get these simulators and get infected in different ways to explain how different strains and different variations work and how can you detect them and that way trace the infections with a strain. So So I will say that is the most, differential, not that we were unique at all creating that type of things, but the thing that we try to make sure that we explain. This is a moment when you need explainers and to be very divulgative, but also a moment of complete uncertainty about what you, how the disease work in particular. Yeah, that is what I wanted to provide. Thank you.